Hey, what's up, everybody? It's Dr. Jason Jones back with another episode of Health Made Easy. And these next few podcasts that we're going to do are going to be focused around a problem that so many people have. People spend billions and billions and billions of dollars every single year trying to solve this problem, and is the problem of lack of sleep. And insomnia, no matter what you call it, the reality is so many people are suffering with sleep issues. And we want to do everything we can to help solve that problem because when we have sleep problems, it essentially affects everything from our energy levels to our ability to focus and concentrate. Our health deteriorates, we gain weight. There's so many issues that lack of sleep actually creates. So, what we're going to talk about today with that is why some common sleep recommendations, especially sleeping pills and prescriptions and things like that, may not work for you. Because over the years, we've had so many patients in our private practice complain of things like insomnia, even after they take sleeping pills and prescriptions. And you may have experienced this as well, and may have been forced yourself, to sleep several times, with pills, and just not getting the results that you want. Well, I can tell you this, you are certainly not alone because according to a survey, about 1/3 of U.S. adults with sleep problems complained that they had to use sleeping pills and prescriptions, but still did not get a restful night's sleep. Besides that, 6 out of 10 people taking sleeping pills report side effects such as feeling confused, being drowsy, and actually being forgetful the next day. So you may ask yourself, well, why do some sleeping pills and prescriptions not work? Well, first of all, you must understand that not all drugs sold over the counter or prescribed are safe and effective. Secondly, most sleeping pills are classified as sedative hypnotics, meaning they essentially only sedate you, but don't really help you sleep adequately. Over the counters, for example, rely on things like antihistamines, which actually cause drowsiness as a side effect. And the oldest types are anti-anxiety drugs such as trazolam and temazepam, which make you feel sedated by slowly slowing the activity of your brain and your central nervous system, which, in my opinion, is never a good thing unless it happens naturally. The newest type of sleeping pills or prescriptions, regardless of the name that they affect brain chemicals that are involved in the sleep wake cycle. So, why don't they work and what can you actually do about it? Well, most of these drugs will only make you fall asleep faster or increase total sleep time by about 20 or 30 minutes, way less than what the average person needs, but they actually don't help you get more adequate sleep. Studies have shown that drugs like Relamiton only make people sleep or fall asleep about 9 minutes faster than those who took the placebo. Also, participants who took Suvoxavant, I hope I'm saying that correctly. It's Suvorexant, got only another 10 minutes where their eyes were actually closed than those who took the placebo. So, sleeping pills don't seem to reduce things like anxiety or clear up things like depression because I can tell you that if you talk to mental health professionals, they will tell you that these folks do not sleep that well. And if they do sleep, they're just unconscious. They're not actually getting deep, restful sleep. And this affects their mental status. They also don't seem to even encourage, the medications don't seem to encourage the kind of inner and outer change needed for quality sleep. In a way, they only distract you from what you really need. So you also develop what's called the morning after effect. So besides the short-term effect of sleeping pills and prescriptions, they also have side effects causing people to feel things like dizziness, drowsiness, being confused and unsteady, the morning after they take them. Some people with sleep problems have recorded things like hallucinations, sleep walking, sleep driving, sleep eating. Nobody wants to sleep eat. Memory lapse and other odd behaviors in the morning after taking the sleeping pills and the prescriptions. The bad part is that when Long-term usage of these drugs can actually develop into habit-forming issues, and you're likely to suffer a rebound effect when you decide to stop taking them, and this certainly can worsen the insomnia. In addition to that, the risk of sleeping drugs gets heightened when you misuse them. For example, if you take these drugs with other sedatives like alcohol or other prescription drugs, they can lead to slowing your breathing down as well as physical and mental impairment that may persist into the next day. Besides, when you take sleeping pills and prescriptions within 4 hours or less of sleep before starting an activity that requires your concentration, you can still have it circulating in your bloodstream, and this can make you less alert when you need to be active. So, if what you are looking for is quality sleep and a regular circadian rhythm, you can follow some simple natural measures and possibly some other techniques, including things like cognitive behavioral therapy for insomnia. And these measures can be much safer and much longer lasting. And that's what we're going to cover in the next several podcasts. But I want to just kind of prime things today with something that a lot of people are doing, which is taking prescriptions. And I'm not telling anybody not to take prescriptions. That's not my training. That's not my expertise. What I am saying is that what it looks like is that most are still having sleep issues, even though they are taking them. And yes, they may be unconscious. Yes, they may be out for longer. But are they actually getting adequate sleep is the question. So, hope this helped you out. This is Dr. Jason Jones signing out. We're going to see you on the next few podcasts with some solutions. See you later. Bye-bye.